Could each state create their own single-payer healthcare system? Dr. Sam Metz thinks so. Check this out. Leave your comments, ding the bell, share it with your friends, and subscribe to our channel. He's a retired anesthesiologist. He's a member of Physicians for a National Health Plan, PNHP, and the Mad as Hell Doctors. SamuelMetz.com, METZ.com is his website. PNHP.org is the PNHP website, and the Twitter handle is @PNHP. Dr. Metz, you've been writing about the possibility that there could be enabling legislation passed at the federal level that allows states to put into place their own single-payer health care plans, including and using for those or toward those the money that's available through Medicare and Medicaid. If I understand this correctly, I believe that was the barrier that Vermont ran into when they tried to do this. Educate me, please.
Thank you for allowing me on the show, Tom. You are correct. Most federal laws now regarding health care prevent any single state from collecting all of the federal money and all of their own money that they currently spend on health care and put it into a single pot. About 85% of each state's health care spending is governed by a federal law, which really hampers the ability of states to use their health care dollars wisely. Some of these federal programs, like Medicaid and the Affordable Care Act, do have waivers, though they're hard to get. Medicare has only issued one waiver in its 60 years. And the biggest law that prevents states from collecting all the money spent on health care is a formerly obscure law called ERISA, the Employee Retirement Income Security Act of 1974, which says that states cannot legislate anything that employers do. Without federal enabling legislation, any state plan is so complex it risks losing the simplicity and the administrative savings of a universal care plan.
So this is not just a matter of HHS or whatever agency might be regulating that cash issuing a waiver to the states. This is something that needs to be fixed with federal legislation. Do I have that right? And that's what Ro Khanna is trying to do right now?
That is exactly correct. Ro Khanna's House Resolution 5010 would allow states to apply for one single waiver, which, if approved, would allow the state to collect all of the federal money that they currently collect and mobilize all of the money that's being spent privately and direct it into a single plan. That single plan, which has one insurance form, one formulary, one drug purchase plan, one payment plan for the whole state, could cut back administrative costs at least by half. For nationally, that would be $600 billion, which is more than enough to address the unmet medical needs in the United States, spending no more than what we spend now. That's the remarkable ability of Ro Khanna's plan. It doesn't require the U.S. Congress to create a single-payer plan, which would be ideal, but it also takes the U.S. Congress out of the way so that states can try this on their own. That's the remarkable, groundbreaking goal of this legislation.
Now, Tommy Douglas, as a young man, had an injury to his leg that festered for 1.5 years because his parents couldn't afford to take him to a doctor. Finally, a kindly surgeon took pity on him and actually did what would have been a very expensive surgery because it had now infected the bone in his leg, and it ended his need for having the leg removed, an amputation. And so he was very into healthcare, you know, and he became the premier of Saskatchewan, the governor of that state, essentially, how we would call it in the United States, and worked, and then he went into the federal legislature, and for years in the federal legislature worked for a single-payer healthcare plan, and was unable to do it. Came back to Saskatchewan, became the premier again, and passed this. And other provinces, other Canadian provinces, saw how well it was working in Saskatchewan and said, hey, we can do this. And, you know, within a few years, it had spread all the way across the country, at which point the Conservative Prime Minister of Canada at the time, I'm sorry for forgetting his name, said, oh, this is a good idea, and put this into place nationwide. Are you expecting that if, for example, California and Vermont, two states that have already expressed an interest in doing this sort of thing, if they could just get this waiver, if they were to do this tomorrow morning, that within 5 years we might have a national health care plan, you know, happening that same way, that it would move across the country like marijuana legalization or raising the minimum wage has?
Yes. And in fact, Tommy Douglas created North America's first single-payer plan in his province, as you noted. And 40 years later, a poll of Canadians voted him the most popular, most important Canadian ever. And his competition was Wayne Gretzky and Gordon Lightfoot. So the Canadians clearly appreciate what he did for health care. And we could do the same thing. Let's suppose my home state applies for this federal enabling legislation, accepts it. We try a single-payer plan in Oregon. And as you said, one of our neighboring states says they can do it, which means we can do it better. And the next state comes up with a better plan. And the next state comes up with a plan that's better than that. And every state that recreates its own universal single-payer plan does it better, and we march across the country. At some point, maybe we'll become like Canada. Canada does not have a national single-payer plan. They've got 14 different provincial and territorial plans, but they all work in synchrony. They're all modestly different. Each one was better than the one before. Imagine in the United States with 50 different improvements on the first state.
Yeah.
If we have if we have 5 states, maybe the federal government, maybe Congress will say single payer works. It's not an experiment anymore. It works, and our citizens, our constituents are clamoring for it. Let's just cut to the chase and create a national plan.
Yeah, it seems so straightforward. So yeah, I'm totally with you. Dr. Metz, thanks so much for dropping by and telling us about HR 5010 that Rep. Ro-Khanna is doing. People can call their members of Congress. I really appreciate you dropping by.
Thank you so much.